Here's some information about dental bridges that you probably don't know. I've seen patients do bridges from other offices and they fully regret it because they didn't understand this one thing that maybe your dentist isn't telling you about. And that's the fact that when you do a dental bridge, you are drilling on the adjacent teeth, the teeth next to the missing space. Let's say you have a missing tooth, which leaves a space. You basically have two options to do a dental bridge or a dental implant. What I don't think a lot of people understand is that you actually have to drill down those teeth into like little stubs to make room for the porcelain, and then you take the dental bridge and you glue it on the tooth. Because if the teeth that are next to the missing space are virgin teeth, they've never been drilled on, no fillings, no crowns, no bridges, no previous dental work, no root canals or anything, then I generally wouldn't recommend doing a dental bridge because it doesn't make sense to drill down healthy teeth just to put in a bridge. Basically, you're filling in one space, but you're drilling on the other two spaces. So when you look at the analysis of whether this is gonna be good or better for you, I generally as a dentist steer people away from this type of treatment and we start looking at dental implants. Now, is it bad to drill down on these teeth? I think it is. The more you drill on teeth, the worse it's going to be. So if you drill on these teeth that are next to these, just to do a dental bridge, you're doing the dental bridge, but you're drilling on these other teeth, which makes them more prone to having problems in the future. Generally, I like to steer my patients away from that. So what I recommend instead is for them to do something like a dental implant. Now, in case you don't know what a dental implant, it's a titanium screw. It just replaces one tooth. And one of the biggest advantages of a dental implant is the fact that you don't have to drill on the other teeth. Now, in a different situation, when patients have adjacent teeth or teeth that are next to the area which the tooth is missing, and they already have a bridge, a pre-existing crown, maybe some fillings, maybe a tooth that's cracked or already broken, then that's a perfect example of when to do a bridge because you already have those teeth drilled down. So you're not actually doing anything that doesn't need to be done in the next 2, let's say 3 or 4 years. Like let's say for example, you have 2 teeth that have crowns on them and you want to do a dental bridge because you're missing this molar. You basically remove that tooth and now you take those crowns off, you do a little bit of prep work, and those teeth are essentially prepped. They're essentially ground down already for you. So you just convert those 2 crowns to a dental bridge, which is a perfect situation for doing a bridge. In case you don't know what a bridge is a porcelain fused to metal or a full ceramic bridge. It's essentially like 3 crowns that are stuck together and you cannot floss in between them. When you floss, you have to floss through or use a water pick instead. And this is a permanent restoration, meaning that that bridge is going to be in your mouth forever. We glue it in and it is there for life. Potentially it is there for life. And one of the other biggest disadvantages of getting a bridge versus something else like a dental implant or just leaving the space is the fact that in the future, if you have a problem with one of the teeth, you have to replace the entire bridge. So let's say you have a cavity underneath your bridge because you're not flossing it enough, or you just eat a lot of candy, you don't go to the dentist, whatever the fact is, you have a dry mouth, or you're just prone to getting cavities. If you get a cavity underneath that bridge, you have to remove the whole thing and get a whole new bridge, which is extensive and you're drilling on the teeth more. And it's just a process that nobody wants to go through again. So my recommendation is if you're high risk for cavities, probably look at a different restoration. A dental implant is probably going to be a better device for you because implants can't get cavities. And dental bridges can, and if you have a problem on one part of the bridge, you have to replace the whole thing, which is probably the number 2 biggest disadvantage of a bridge versus something else like a dental implant or a different restoration. And if you'd like to know more, and if you want to know more about your teeth, your gums, your health, your oral health, and things to stay away from, I have much more videos on different topics like which is better, a dental implant or a dental bridge. And I'll see you in the next video.